So first they are given lamotrigine. Is it a drug of choice? No, it doesn't work that way. Is valproic acid drug of choice? It doesn't work that way. There is no drug of choice like that. We have to choose the drug according to the individual patient. So for focal seizures, again lamotrigine, carbamazepine, oxcarbamazepine, phenytoin, levetiracetam. All this can be used. Typical absence seizures, valproic acid, ethosuximide, lamotrigine. Atypical absence seizures, valproic acid, lamotrigine, topiramate. All this is given. Okay, and there are hundreds of alternatives as well. So I am just going to deal with it based on the type of the seizures. So let's see what we can do. So focal seizures. So what is the preferred drug? There are 5 preferred drugs. Carbamazepine. For focal seizures, the first thing is carbamazepine and oxcarbamazepine. These are the 2 drugs. The advantage of carbamazepine is it is going to follow first order kinetics, which means it is going to have a very less toxicity. Cannot be given in aplastic anemia patients because it is going to cause leukopenia, or it cannot be given to patients with liver failure because it is going to cause hepatotoxicity. These 2 things are very important, aplastic anemia and hepatotoxicity, but as such it is going to follow first order kinetics and less toxicity. So this is carbamazepine. Oxcarbamazepine is slightly better than carbamazepine in its side effect profile, but again both these drugs can cause hyponatremia. So a little bit tricky to give it in elderly, but this is going to have a fewer drug interactions than carbamazepine. So in elderly, if I am going to give, I will prefer oxcarbamazepine better than carbamazepine. So these are the first 2 drugs that we have dealt with in focal seizures. The next ones are lamotrigine. It is well tolerated, but again it can cause very severe SJ, Stevens-Johnson syndrome. It has a great possibility of a Stevens-Johnson syndrome. So again, monitoring is very important. This is about lamotrigine. In phenytoin, the advantage is it's a long-acting drug and it can be given in OD doses or BD doses. And but the problem with this is it follows a non-linear kinetics, which means that if you go a little above the maintenance dose, say you go a little above the standard maintenance dose, it can precipitate marked side effects and which is going to cause acute phenytoin toxicity. So other features are hirsutism, we've already discussed, causing of facial features, gingival hypertrophy and bone metabolism. All this can happen with phenytoin. Then levetiracetam, the advantage is there is no drug to drug interaction. That is why lot of doctors prescribe levetiracetam because of this known drug to drug interaction. Especially it is useful in elderly. Again, there is a small issue with irritability and psychiatric features that can occur with levetiracetam, which is again very less with brivaracetam, which is less with brivaracetam. So that is why levetiracetam is preferred. So for again focal seizures, carbamazepine, oxcarbamazepine, lamotrigine and phenytoin and levetiracetam are the drugs that we usually prefer, and based on the complications that can occur and the propensity of the patient to develop a particular complication, the correct drug has to be chosen.